Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm your host, Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Katrina Sanders. Now, Katrina has been a practicing clinician for over a decade. She's well known for her calling dental professionals to action in promoting the testing of patients for diabetes. We're going to be talking about her course, All Together Now, The Oral Systemic Connection. I love that title. Thanks so much for being here, Katrina.
Thank you. Thank you for having me.
You betcha. Now, oral systemic connection. We have heard a lot about this over the last several years. We're seeing a lot more in print. It's kind of a buzz topic, and a lot of people are talking about it. So what is it about your course that makes it significant for the dental provider to attend?
Thank you for the fabulous question, because I do think that we are just flooded with gorgeous research that is being done about the oral systemic link. And as a dental provider, we love that. That validates what we do as professionals. It's a nice little bow on top of our treatment planning, right? Oh, and if you don't get this periodontal therapy done, we may be at elevated risks for heart disease, stroke, cancer, and the list goes on. But what I tend to find is that although we continue to read these articles and integrate this research, it does two things for us. One, it instills more of an understanding for the dental provider in what we need to be doing, to really take an active role. But two, it leaves us wondering, what is it that we should be doing differently within our clinical practices in order to truly be a part of this change, this evolution that needs to be happening within the dental community. So, for example, you brought up the diabetes and the point of service HbA1c testing. And it's something that I'm incredibly passionate about. We all know somebody who currently has diabetes or is in the category of pre-diabetes, where as dental professionals, and specifically for the hygiene community, where we take an active role in that preventive therapy, it's important for us to find those ways to be able to assist our patients in the management of that disease. So I've certainly developed some coursework that allows the dental professional to take this point of service testing and integrate it directly into their practices. I think those tangibles are so important. As a speaker, if I'm going to be delivering a call to action, if I'm going to be telling my participants about all of these new research pieces, that I need to be giving them tasks, things that they can be doing to begin to create some of the change that we need to be seeing within the dental community.
So, okay, thank you. Now, as I'm listening to you, I'm wondering, because that sets us up really importantly with what the challenge is and what we need to accomplish. So how do we go about that in your course? Can you tell us a little more about how we learn? Is this lecture? Is it interactive? What do we leave with to take back and put into use on Monday morning?
It begins with a lecture, but it certainly has some interactive components to it, because there are things that we did learn in dental and dental hygiene school that are beginning to evolve beyond what the original textbooks we had currently say. So we do a lot of interactive information, specifically with nutritional counseling, where we look at food diaries and we talk about low glycemic index food items. We talk about anti-inflammatory food products, and we talk about how those allow us to really integrate nutritional counseling in a significant way for our patients. And so from a lecture standpoint, it's really robust and very rich in specific things that we can integrate, but it also workshops well because our participants are able to actually practice some of the techniques that they will be integrating on Monday morning. It's a really great team building course because one of the challenges that hygienists have is we go to continuing education coursework we come back and we're really excited about the things we learned, but maybe the other hygienist in the practice or maybe the doctor aren't necessarily on board with the things that we want to integrate. So this is a beautiful course for a team of providers where they can then come together during the workshop and decide how are we going to integrate these so that Monday morning we are now ready to instill these incredible changes that will make our office leaders in the oral systemic link management, but also productive, which is another important piece in dentistry as it is a business.
So what I'm hearing you say is that it's appropriate for the dental team as well as the dentist and hygienist. It's really good for the entire team, and in fact, it would be great for the entire team to attend. What is your suggested length for this course?
Suggested length is 3 hours, although it can expand and contract based on how detailed the meeting needs to be. So it can go down to even a 1 hour course where we go over Katrina's Easy Threes, where we talk about 3 easy, strong steps that can be integrated on Monday morning, but more of a workshop type setting. We're going to look at about 3 hours for the course.
Katrina, is there anything else that would be important for the event planner to know about this course before we're done?
I would say, in general, hygienists are incredibly passionate about the preventive services that we provide. And the more that we're beginning to seek that validation with regards to the oral systemic link, the more that it becomes important for hygienists and dental professionals to be able to take the things that research is showing and be able to integrate it. As somebody who's incredibly passionate about dentistry and really wants to create that call to action for dental providers, it's important for the meeting planner to know that as I'm continuing to educate and build this course for the participants, that they're going to walk away with easy, tangible things that they're going to be able to integrate starting Monday morning. And those things are going to allow them to continue to grow and develop within the dental community. And so it's something that I'm passionate about, and it's something that your course participants will feel and will be able to truly make that change.
And it is a super important topic. You know, it's so important in so many levels to get this knowledge out there, not just to dental professionals, but to patients and ultimately to medical providers as well as an important link. So thank you for bringing your take on this with your experience and your knowledge. While this is certainly not a brand new topic like it was not that long ago, I think it's so important that we continue to have our providers out there sharing their experiences, and it's something that is well worth continued courses as it continues to unfold.
Absolutely. And to continue to add to that a little bit, I think one of the challenges that we run into is, as dental providers, we know the research. The challenge becomes, how do we integrate this research to a population of patients that maybe don't necessarily understand that? How can we do it without lecturing to our patients? We're able to change the value that our patients hold when it comes to their dental care. We are no longer just scaling teeth. We are screening for sleep apneas. We are looking down the airway and evaluating. We are screening for diabetes. We're screening for high blood pressure. We are now able to manage the bacteria that is directly linked to colorectal cancers and stroke and plaque buildup in the heart. So the more that we are continuing to learn about these things, and the more that we continue to become passionate about it, we need to be able to find ways to have that relate back to the patient so that our patients truly understand the roles that we are playing in being able to improve their quality of life with chronic disease.
Agreed. Thank you so much for sharing with us today, Katrina. And for the event planner who would like more information on bringing Katrina Sanders for their next event, please visit dentalspeakersbureau.com, where you can find out more information and we can help connect you with Katrina. Thanks again for listening into The Buzz, and until next time, be well.